Welcome to the Pod of Inquiry, pushing the envelope for human understanding and optimization, the podcast for podiatrists. The Pod of Inquiry is designed to empower you with knowledge. What happens from there is up to you. Your host, Dr. Stephen Barrett, has designed this show to take you down some very deep rabbit holes, hopefully bringing you back out again, relatively unscathed, but cerebrally whipped, enabling a better understanding of all things worthy of inquiry. If you have more questions after the show, then that is good. The new discovery today many times was the new discovery 50 years ago, only to be suppressed or plainly ignored. Medicine and surgery can sometimes take a long while to get their paradigm shifted. We hope to have a lot of fun on this show and maybe destroy some ridiculous dogma along the journey. Thanks for joining the show today. Let's start spelunking.
This week's episode, I'm back with Dr. Edward Glaser again. We had so much fun last week that I had to extend this interview that I had with him and break it into two parts. It'd be great if you want to go back and listen to the first part, but it's not necessary as we really discuss a totally different thing that he's been working on. For the last several years, Dr. Glaser has been lecturing on what he calls the Relax, Release, Relief technology, which is a series of releases designed to manually and mechanically interrupt the neurological feedback loop that causes so many instances of chronic pain. The triple R technique, as I call it, is a preferred method for arch support break-in with his Soul Support custom orthotics. I know that you'll enjoy listening to this episode because it is something that is so radically new that really needs further exploration and investigation. And I know that it could provide another weapon in your armamentarium against chronic pain. So without any further introduction, please enjoy this conversation that I have again with Dr. Edward Glaser. Well, I'm back again with Dr. Ed Glaser at his farm in Palmetto, Florida. Thanks again for having us down, Ed. Last episode, we talked about biomechanics and orthotics and what you were doing in that arena, and that's all great. And I don't want to mitigate that, but this next thing that we're talking about is going to be pretty exciting for people. And had I not just had this done to me, I don't know if I would really believe it or not. But,
nobody does until they experience it.
Yeah, so let's tell them what we're going to talk about. It's called the RRR, right?
Yeah, which stands for Relax, Release, Relief. And basically it's a manual, incredibly gentle, light touch. If you know how to position the body and can tell somebody to push against you very lightly, then you touch one of these points. We call them relaxation points in the body. And it has to be extremely light. How light? Either they don't feel it at all, or they can barely tell something is being done. Any harder than that, it won't work.
I think in your manual you gave a great analogy about it's about the pressure you would put, pressing on your eyeball.
Right. In fact, I would say it's about as hard as you would push the point of a pencil into your eyeball. That's how light it is.
Okay.
And believe me, you wouldn't push very hard.
No, not at all.
It's so light, it's unbelievable. And then what you're feeling for is you hold a unidirectional slide in one direction. It's very light. Again, they barely even feel it. And suddenly at about 15 to 45 seconds, the skin will detach from the deep fascia, and you'll feel your skin and their skin stay together, but their skin slides on their deep fascia, telling you the release has already started. And I've had 2 people out of thousands that I've done who could actually feel the release happening. So they told me exactly when it started and how long to stay on it before they left. And recently I found a way of actually making people feel their releases, only if they're doing bilateral releases off the same point. In other words, you can have somebody take their hands and grasp the right hand into the left and pull apart,
right,
while you press on the manubrium very lightly.
Tell people what the manubrium is.
Manubrium is the top of the sternum. If you find your sternal notch at the very top of the sternum and drop 2 inches, you're on a domed, round bone that is the very top of the sternum. On its sides, it articulates with the clavicles. On the bottom, it continues as the cartilaginous breastplate.
Okay.
And it's coated with a deep light touch receptor that is a reset button for pain.
And that would be the Pacinian corpuscle?
Exactly. The Pacinian corpuscle is designed exactly for what we're experiencing. It's funny, when I started researching, every article I read said the same thing. You can tell what a mechanoreceptor does by its structure. Mm-hmm. So here I was looking for a light touch receptor that was different, that on its outer surface was one thing, but in its innermost core was something different. And what we looked at, when you look at the Pacinian corpuscle, firstly, it's gigantic. It's 1.2 by 2.8 millimeters, visible with the naked eye.
For a receptor.
Yeah, and it's a 1-to-1. One axon divides into 1,000 free nerve endings, 500 ruffinians or Golgi tendon, who knows how many Merkel cells, but it's a 1-to-1 with Pacinian. You invest an entire spinal neuron on every single receptor. This is how important they are. And they're for light touch, not for vibration. They talk about them being, that's how you confuse one and get a lot of output out of it. But in actuality, they're for balance and proprioception.
Okay.
When even your light tissues, when you move your arm in a certain direction, you'll compress tissues or pull taut tissues on one side of the joint, and on the other side you'll loosen. Mm-hmm. And it can sense that and tell you what muscles to fire to, and where you are in space. So
wow.
For balance, it tells you what muscles to fire to remain upright. You don't even think about it.
No, subconscious.
It's ingenious.
Right.
But in its inner core, the outer 60 layers are mesenchymal in origin. The inner 10 are neural.
Okay.
And when the neural membranes touch the naked nerve in the center, there's something akin to a short circuit. I don't know exactly how it works electrochemically, mm-hmm. but it's as if it's bleeding current from the spinal cord into the local tissues under your fingers. And that changes the viscosity, the thickness of the extracellular matrix, which can change from Gorilla Glue to WD-40 in a matter of seconds. And it does so in response to heat and Bikram yoga, pH, more basic is more flexible, and electrical discharge, concentration of water, drink more water, concentration of hyaluronate itself, and there's an enzyme, hyaluronidase. Mm-hmm. But what happens is the electrical discharge into the area under your fingers on the relaxation point cause the hyaluronic acid to become more fluid, and the skin separates from the deep fascia and slides suddenly in about 30 seconds. You can easily feel it, then you know the release has happened. So what you're doing is you're shortening the muscle you want to release, hold it there, fire the opposite muscle, okay. which now becomes the agonist.
Right.
The shortened one becomes the antagonist. Antagonistic inhibition inhibits the shortened muscle. Then you touch the relaxation point. And where that inhibition from the relaxation point overlaps the antagonistic inhibition of firing its opposite muscle,
right.
that's where the release occurs. So you're directing the release through antagonistic inhibition, but the release is coming from a relaxation point by bottoming out a Pacinian corpuscle.
Now, I would, like, if I hadn't experienced this earlier today, you were kind enough to do this on me.
Well, why did you get it done? Say you were experienced.
Oh, I've had low back pain for more than 20 years, and in fact, it's the reason I had to quit playing golf. And I don't know, maybe you just cost me a lot of money today. I have to go buy a bunch of golf clubs, right? But anyhow, it's a pain that I manage. First thing in the morning when I wake up, if I don't get out of bed right away, start walking around, it's significantly uncomfortable. So it isn't one of those like CRPS type of pain that is just totally debilitating, but it is significant enough that it has altered my lifestyle. But long story short, I have zero back pain now, and usually when I twist around and that type of thing, I can feel the catch and the, like somebody's digging in on you and that type of thing. The uncomfortable sensations, I have zero of that now. It's pretty incredible. So I guess that's a long-winded preface into, sometimes you have to experience things to really get a grasp conceptually and to try to dig in deeper, like what's going on here with it. Because you don't traditionally think of the Pacinian corpuscle as a
reset button.
Well, or as a nociceptive receptor as well,
It's
but
actually,
I guess they are, all these mechanoreceptors.
It's not feeling pain, it's inhibiting it.
Okay.
So it's inhibitory for pain. In fact, if you push too hard, the reason you have to push so lightly is that all 4 of the stretch receptors, that is the Golgi tendon apparatus, corpuscle of Ruffini, the free nerve ending, and the Merkel cell, all of them are excitatory for pain. Easy to prove. Try to touch your toes. It hurts. Stretch is excitatory for pain.
Right.
And you can see the Merkel cells because people in CRPS, if you blow on their skin, the movement of their hair follicles, which is basically
drives them crazy.
Yeah, it feels like a blowtorch.
Right.
And it's what surrounds your hair, each hair follicle, Merkel cells. They sit above the basement membrane. So we knew it wasn't them. We knew it wasn't free nerve endings. They're excitatory for pain. They're called nocioceptors.
Right.
We knew that Golgi tendon and Ruffini were both stretch receptors, and you could tell by stretching that hurts.
Right.
And there were only 2 that were inhibitory. The fastest adapting, the Meissner and the Pacinian. But the Meissner was too close to the surface to actually explain the phenomena we were seeing. We were observing a detachment of the deep fascia from the skin. And when the skin slides, the release is happening. So I had to look for a receptor that would explain the phenomena we were seeing.
Right.
I'm telling you, it's much easier to find the answer when you already know the answer. And the answer was, this is the technique that works. How does it work?
Right.
And there was the Pacinian to answer.
How did you hear about this?
A guy came up to me at the end of one of my lectures in Seattle, a massage therapist working for a chiropractor named Arik Goel. And he said to me, you say it takes a month to get used to your product. I'd say, if you're lucky, maybe 6 weeks. And he said, I do it in 8 minutes. And I said, it's not possible. Actually, I didn't say it that nicely. But bottom line is, he showed me how to do it. I thought it was complete BS. I took it back to my plant. I have 100 employees. So I had them file through my office. One went down to get the next one on the line, till all 100 came through my office. And I asked each one what foot pain they had. And no matter what they had, and some of them were really, I was shocked. One of the ladies was life flighted to Vanderbilt in the middle of the night, and her foot was hanging on by a blood vessel. And they salvaged her foot, but every ligament was torn, and it still worked. And you ask how? I have no idea. Right. There's more about this that I don't know than I do know. My goal is to give it to as many people as possible, so that it will rouse the interest of people smarter than me. They, you know who they are?
Yeah.
The International Association of People that know more than us. And
it's a big group in my case.
Yeah, mine too.
Yeah. So then after you were introduced to these concepts and technique, then you spent some time really digesting it and doing what you usually do and approaching it with analytic.
I flew the guy to Nashville because I wanted him to film it.
Yeah.
And we have a video studio at the plant and a full-time videographer. So when we were finished filming, and I said, look, I'll edit it, give you a finished product. You can put it on your website, charge whatever you want. I just want it available for my customers. Mm-hmm. And he did that. He put it on his website and people paid him. And then when we were finished filming, I had a friend whose daughter had CRPS of her left knee, 4 years duration, age 10 to 14, pain level 7 to 10. They were ready to cut her leg off. Mm-hmm. She had so many level 10 incidents. Rushed to the emergency room, taking gabapentin, steroids, and opioids. at the same time. Everything. Yeah, she was shotgunning it and still in terrible pain. And they were going to cut her leg off. And I called her up, her mother, and said, take her out of school right now and bring her here. I have somebody I want her to see. And he barely touched her for about 10 minutes. Put her in a position, said push here, and barely touched her. And she stood up completely pain-free. She was told never play sports. She went out for volleyball, basketball, and track every year in high school. Won most valuable player senior year in volleyball and basketball.
Wow.
Went on to a full basketball scholarship to college. Then I had to eat my hat and realize I was wrong. And I tried to find the guy, and he had fallen off the face of the earth.
Yeah.
And then he called me up. He sent me a text, actually, inviting me to his wedding. And I couldn't make it, unfortunately, so I paid for his mariachi band.
There you go.
So I said, before you get married, would you come up and spend a few days with me? I want to get people, I have to know if this is real. So from a local support group, they sent me 11 CRPS patients. At the end of the 20 minutes of treatment, that's all I gave them. 3 of them were completely pain-free. 4 of them had a stable reduction of over 60%, and 4 had no effect. Wow. I was ecstatic. I said, you put 3 people in remission.
Right.
He goes, I could have helped them all if you'd given me more time. So I said, you're on. And I pulled $170,000 out of my retirement, and I put it in the bank, and I said, I want to hire you. What do you make? And he said, 50 grand. I said, I'll pay you 70. And you could still work in Guadalajara, and where he lives. And come, I'll fly you up here 1 week out of every month, and we'll go around the country. And at the end of the year, we had treated 81 people in crazy pain, people who were completely disabled with pain, and 64 of them ended up completely pain-free. All of the rest had a 90% reduction stably of their pain, except for 2 that claimed they had no effect, although I really doubted, considering how much they were improved in their motion and activities. So I think they were just afraid they were going to lose their disability.
Right. Well, and then I imagine you have videos of those folks,
Yes.
right?
Yes, we have videos of most of the 81 people. I lost a few because some were on my phone, and I lost my phone.
Right.
So I lost a few videos, but yes, we have most of those. Plus, I've been videotaping people for the last over a year and a half. I have a free pain clinic where people come from all over, and they literally have to hold on to furniture,
Right.
and I have to help them out of the car to come in here, and they walk out on their own reconnaissance, pain-free, in a matter of hours. Although fibro can take 2 or 3 days now.
Right.
But you know why it takes longer? Because they fall asleep.
That's what you were telling us that earlier. Now, the other thing that's really interesting, not only did I see a reduction in pain, almost like 100% now, as I'm sitting here, maybe 2 hours ago you finished up on me, but the other thing that I saw was you increased my range of motion, and I'm like tight as a drum, and
this returns
very short order, and those are, range of motion's a pretty objective thing,
Yes,
the
you
pain
can measure
scale's
it.
not so objective,
Yeah.
It's like, it's a 5 today, it's a 4 tomorrow, whatever. But if you can't touch your toes, and then you can touch your toes, or you can, it's a drastic
Yes.
thing that you can see very easily and pretty objective.
Very objective.
And I can tell you, I wasn't trying to fight you when you were trying to get motion. That was just all that I had. And then short order, 20, 30 degrees more motion.
Yes.
So
Sometimes we'll get even 50, 60, 70 degrees in increases, and it's permanent.
that's what's crazy, isn't it?
I check people years later, and they still have the range of motion, and they're still pain-free. So I was racking my brains. How could it? I'm not healing anything. I'm not curing anything. You're no healthier at the end of this.
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor. Well, folks, if you are over 40 and you are not using a supplement to augment nitric oxide production, you should really think that. This molecule is absolutely imperative to health, not to mention its cardio protection. If you have any question on nitric oxide, I suggest that you go back and listen to The Pot of Inquiry, Season 1, Episode 3, for my conversation with one of the world's experts, Dr. Nathan Bryan. I never miss a day of nitric oxide supplementation. That's how important I believe it is. Long overdue, there is now a nitric oxide replenishment formula without the fear of oxalates. Approved Medical Solutions does not use beets, spinach, or arginine. Approved Medical Solutions is proud to offer our audience their oxalate-free nitric oxide formula. If you are not a healthcare provider, you can still get started by going to approvedmedicalsolutions.com and use the code SBarrett, all lowercase, at checkout, and you will receive a 10% medical discount savings. For licensed practitioners, go to approvedmedicalsolutions.com and register. They have unique bundles for all of the full-fledged spelunkers of the Pot of Inquiry. Use Pot of Inquiry at checkout after registration, and I'm certain you will be pleased not only for yourself, but all of your patients. Here's a little secret. If you order their testing strips and test every patient for a few clinic days, you will see every one of those patients will be nitric oxide deficient. When they see this result, they will want you to start them up immediately. Now, thanks to Approved Medical Solutions, you can give them the best care without the worry of oxalates.
Why is this doing it? And the only thing I could come up with is it's resetting the pain threshold.
Mm-hmm.
And sure enough, what it is an electrical phenomena that simply, you see, the human body is doing what it should. In an injury, it's supposed to close the gate or the switch in the spinal cord that allows everything that goes up to the spinal cord to pass right through and come back down, completing what we call the positive feedback loop that is chronic pain.
Right.
And all I do is I break that loop and allow the pain threshold to reset to where it was originally. In fact, I would say that you've already done, or the patient has already done the hard work. In other words, they healed.
Mm.
And you're saying yours is 20 years ago. I knew I could get rid of your pain. You know why? Because it's 20 years old. It's already healed. The only thing left
Is the pain.
Is this stuck switch. And I'm unsticking the switch. And you do the perfect surgery and everything's beautiful and the x-rays are gorgeous. The fixation is perfect. And you're going, why is this person still in pain? Well, it's just a stuck switch.
Right.
And I could teach anybody how to unstick that switch and take every albatross around their neck and turn them into satisfied patients. You know what the best customer is? Not one that's never had a problem. It's one that's had a problem fixed to their satisfaction.
Mm-hmm.
And when you run into a normal complication like postoperative pain,
Right.
to them it's a major problem.
Right.
But if it's fixed to their satisfaction, you're a miracle worker.
Right. Now, you mentioned there's a couple of types of pain this just clearly doesn't work on. One of them was gout, which it's a continuing assault on the synovial tissues of the joint or whatever's going on.
People ask me, how long is it going to last? I say till the next pain-initiating event.
Right.
That could be falling down the stairs. In gout, it's the next second.
Right.
In neuropathy, I don't have the neural connection to even get the circuit to start or break.
Mm.
So in severe neuropathy, it won't work. I used to say polymyalgia rheumatica was another one, except I was at the American College of Lower Extremity Surgery a few weeks ago, and one of the vendors had a not too long-standing, because it's only self-limiting disease, lasts 2 to 4 years, but had PMR, and I was able to get him pain-free, stably. So I have to say I'm wrong.
Yeah.
I've had some very interesting cases. Like I had a guy stung by a stingray in his ankle, and 14 years of excruciating pain. I spent 10 minutes trying to convince him it wasn't going to work, and I'll be darned, it worked. Then I had a guy struck by lightning, entered his right shoulder, left his left heel. He was left in severe, crazy pain in his knee and ankle and foot. He said it felt like a knife was going through his foot 24/7 and through his knee. And we were at a casino. He came up to me and sat next to me. I said, "What's wrong with you?" He said, "You're not going to believe this. Struck by lightning." I said, "You seeing anybody?" 7 doctors right now for 7 months. Are you any better? Not even a tad better. I said, you want me to pull the knife out of your foot? He looked at me like I had 3 heads. We went over to a slot machine. I borrowed a pencil eraser from the pit boss. We sat at one of those 2-seater slot machines, and he put his foot on my lap. And 8 minutes later, he stood up and said, the knife is gone.
Wow.
Can you fix my knee?
Yeah.
I said, I have to lie you down. So we took 4 chairs at an abandoned blackjack table, lined him up, and he lied on his back and on his side, and I took away his knee pain.
Interesting.
And he goes, I can't believe it. 7 doctors for 7 months. I've spent tens of thousands of dollars, and I'm no better. And you fixed me at a slot machine.
Wow.
And a blackjack table for nothing. I said, well, you're just going to have to learn to live like this.
Yeah.
Because
without pain.
Because I cannot bring the pain back.
There you go. So, have you published any of this?
Just published the feet points. That's it
Okay.
in the Foot and Ankle Quarterly. Not about the results. I didn't do now I'm actually tabulating my results.
Yeah.
And the truth is, I just had my whole study structure examined by a real PI, principal investigator,
Right.
who told me we're going to start it all over again.
Oh, yeah.
So,
Yeah.
to standardize everything. So I apologize. I now have hundreds and hundreds of videos of taking people out of pain that are, I guess I could use them as testimonial videos, but
Well, I think there's a lot of merit. You know, everybody talks about evidence-based medicine, and nobody gives any credence to anything that's not a randomized, prospective, double-blind study. But there's a lot of merit in multiple case studies. So you might want to revisit that. Because
I'll never be able to do a controlled study.
No, you can't.
You know why? Because I don't have the heart to leave half of the people in pain.
Right.
People are coming to me in such crazy pain. When they call me up, they might call me at 8 o'clock at night, and I'll meet them in 20 minutes right here at the farm, and I'll take away their pain. I might stay here till 3 in the morning and come home, and they'll be pain-free. My wife says, are you nuts?
Right.
I go,
A little.
I said, yeah. You know what? I can't sleep knowing they're in pain.
Right.
It bothers me.
Well, but circling back, I think there's a lot of valuable data there, especially if you have the video
Tons of it.
You know, and that should probably be published, at least compiled and
A pilot study, we'll call it.
Call it a pilot study.
Yeah, but that's about all I could call it.
Well,
unfortunately.
yeah, but in order to get some of this work recognized, it has to get out there in some type of a
Really, I'm
format.
not trying to become rich off this or famous off it. I won't allow anyone to pay me anything. In fact, I give people a free pair of orthotics for allowing me to take away their pain.
Right.
And they say, why would you do that? Because you have a piece of data that I don't have, and there's no way for me to get it unless you volunteer it. It's how you feel.
Right.
And I can't tell you how you feel. And I hate doctors that do that tell people you're not having pain when you are. If you're the one feeling it, they have no right to tell you you're not having pain. Especially they have a tendency to dismiss women's pain more than men, and women feel more pain than men. We should respect that and not deny it.
Right. Well, a lot of times when people don't have a grasp on what's really going on, it's like, it's just in your head.
Right.
Well, the answer is, it might be, but it's because of a pain generator peripherally that's sending it to their head, so.
Exactly,
But,
and their pain is real to them, and that's what's important.
Right.
I had one guy say, I can tell you why your stuff works. It's all placebo effect. I said, well, that wouldn't explain the most critical people that I've done, people that actually the whole time I'm doing it are saying this is BS, it's witchcraft, it's voodoo, I don't want to be here, my wife made me come, and 8 minutes later, their foot pain of 50 years is gone.
Right.
And they go, whoa, if I wouldn't have believed this had I not felt it.
Yeah.
I'm addicted to taking away pain.
No,
Seriously.
It's now, so you're able to treat, with this technique, obviously, many musculoskeletal regions, and, is there some, like you said earlier that the knee was one of the
Most effective.
Yeah.
I can do a knee in 10 minutes, and I don't think I've failed on a knee in 2 years. Neck is the other one. I could return full painless range of motion to someone's neck, and indeed we did.
Right.
To Sequoia right here.
Yep.
And
my partner, who's here so kindly filming this with me, and how's your neck feeling?
It feels great.
Yeah.
And the numbness in my hand is all but gone.
That's pretty incredible. You've been struggling with that numbness for a long time.
Yeah.
And as a surgeon, you really need the feeling in your hand. You're feeling the end of your instrument.
That's right.
Right.
So you'll be and believe me, you wouldn't be working with Steve Barrett if you weren't already an amazing surgeon. But this will take you to an entirely new level. I don't know if it'll help your golf game.
Well,
by the way, I'm fourth.
You know how pissed off my wife's going to be when I get back tonight. She's like, "Well, how'd it go?" It's like, "Well, we need to go down to the golf shop tomorrow because I'm gonna get some golf clubs." I mean, if I wake up tomorrow like I'm feeling today, oh man.
You're going to play golf?
What a cost. What's that?
You're going to play golf?
Oh, I'd love to play golf.
By the way, I just in case your listeners don't know, I'm fourth in the world in golf.
Really?
From the bottom.
Fourth from the bottom?
Yeah.
Yeah. Golf is a really, you know the difference between golf and heroin, right?
No.
There's a cure for heroin. The only thing that can cure you playing from golf is like back pain or something like that. But anyhow, so how do folks, I know you're going to start some training courses on this.
We have our first course coming up in a few weeks, and we're going to set up courses all over the country. But to save money, people can come to Tampa because then I have much less expense.
Right.
Because I'm doing it at my farm.
Right.
And so we're going to have our first course coming up in June, and then one in July. And then starting in August, we're going to set up a regular schedule every month.
And where can they find this information? You've got some really beautiful materials already on the website.
What we did is we went into a studio and we filmed it with 3 cameras, a floor director, post-editing, and then we gave it to a 3-dimensional animator that also works for me, who put in the anatomy under the skin.
Yeah, I saw that. It's beautiful.
It's gorgeous.
Yeah, it's unbelievable. I remember when I first met you, maybe a year after that, you were kind enough to share some of your medical animations. And this was back in the day when that was really, now medical animations are a whole different genre.
We still have the most accurate, detailed human foot in 3D space in the world.
Yeah.
We spent years developing it. It's unbelievable. There's 5 layers of transparency on the skin. It has fingerprints on the toes. The cuticle is there. The skin blanches when you press on it in animation.
That's
it's
incredible.
Unbelievable. Our 3D animator should be working at Industrial Light and Magic for twice the money.
Yeah. We'll have to edit that part out.
No, you could. Yeah. He'll never leave me. Nobody ever leaves me.
That's what you were telling
Except
me.
my ex-wives. And by the way, they didn't marry me for my money, but they did divorce me for it.
Okay.
It's good. Divorcing me is good business.
Yeah.
I hope my current wife doesn't hear that.
Well, just don't let her see the podcast, right?
Yeah.
So, but okay, so they can go to it's rrrtv.net, right?
And
That's
if you want the courses, you just add /course.
Okay.
So rrrtv.net/course will give you all the information on the courses, and also you can register there. You can pay for the course and receive the ticket for the course immediately, and for what I think is a very reasonable amount, you can imagine that
it's a 2-day course.
It's a 2-day course for foot up to low back.
Okay.
And then a 2-day course from low back, mid back up to
top of your head. Okay.
And in 4 days, you'll be able to walk up to someone and barely touch them, and their pain permanently goes away, and full anatomical range of motion returns to whatever joint you're doing. All trigger points disappear permanently. Wow. And all muscle spasms go away. One of the things I did for your back was release all of the muscle groups that go from the thigh up to the pelvis. So now your pelvis is floating, and you can easily control it and prevent yourself from getting a new injury, a new back pain. Basically, I turned back the clock on you.
Whoa, that's great. I've been trying to turn back the clock. It's hard to do, you know.
I can bring you back. Unfortunately, any injuries you had in life, you know, if it caused the bone to grow differently, that's still there.
Right.
But in terms of the pain, it's gone.
Incredible.
It's the weirdest thing. Every podiatrist should know how to do this. Every surgeon.
Yeah, I
Why
think
should
that,
people take opioids?
yeah,
They
you
shouldn't.
know, and the other thing too is that this is a great adjuvant. So they may have had, you know, like you said, the perfect surgery, and they still have some pain. But now, if you're able to, you know, render this type of treatment, then you've taken that patient to a super optimal level of care, which is really what we all want to do. You know, I mean, and then, you know, in some of these really more difficult cases, perhaps we can, you know, keep from taking them to surgery. And sometimes the best surgery you do is surgery you don't do. And,
Sometimes I feel like I'm banging my head against the wall. You know why? I gave a lecture on this and demonstrated at a meeting, and I got comments like, "What does relieving foot pain have to do with podiatry?"
yeah,
I go, "You ought to sell shoes,
yeah.
especially Louboutins, because they're uncomfortable."
Well, my partner is shaking her head.
Well, Christian Louboutin himself.
She is
She's a shoe
she's
person.
a shoe person. Let's put it that way.
Well, I'm married to Imelda Barcos.
Oh, she's got 3,000 pairs, right?
Well, my wife has about 250 pairs of shoes, including Louboutins and, you know,
I've never even seen a Louboutin.
the red bottom shoe.
Sounds like some kind of space thing.
Christian Louboutin says, if you want comfort, don't buy my shoes. This is a shoe for style, not for comfort. And boy, does he mean it.
If you want to look good, suffer the pain.
Yeah.
That's
So we started working for a little while on a shoe that was made in mass posture.
yeah.
And my wife took a Valentino and mailed it to one of the great shoemakers in the world at Andre's Shoes in Beverly Hills. And he created her a one molded to her foot in high heel position in mass posture. It was unbelievably beautiful. Disappeared into her arch. It was,
Did it work?
oh gosh, yes.
She likes it.
But she's one of one in the world that has
Yeah,
one.
right. So if you want that shoe, it's only $22,000. Come on down, right?
No, she wouldn't ever let it go. I'm sorry.
But
You know, it's funny. We invented a shoe. She showed up our first date in high heels. I said, "You can't date a foot doctor in 4-inch heels." She said, "Not only am I going to date a foot doctor in 4-inch heels, but you're going to invent something to make them comfortable."
yeah,
2 years later, after 2 years of think tanks, my employee Keith Copley came up with the Copley orthotic. He said, if you take a high arch and you put it, if you tilt it forward, the front goes vertical, therefore applies no force and is unnecessary. It's extraneous. Get rid of it.
right.
So he got rid of everything over the top of the arch in the medial forefoot, just the opposite of a whale orthotic, which only has the arch and not the lateral side.
Right.
This is the complete opposite. And you know what? After giving it to my wife, after a year, I said to her, you have a lot of pairs of orthotics. I mean, she probably has 40. I said, if I was going to take them all away from you but one, which would you keep?
That one?
She said, the Copley.
Yeah.
And then, by the way, I have an invention assignment agreement with my employees. The inventions belong to me. But this one was so good, I spent the money, patented it in Keith Copley's name, and he gets a royalty on it.
Nice.
And that's you know why you do that? Because it's the right thing to do.
Well, I think you exemplify that and have exemplified that since I met you 20 plus years ago. So, Ed, thank you so much for your hospitality treatment of my back and my partner's neck. And we look forward to really trying to drive some people to your courses. And
I want more than that.
Yeah.
I want you to take this technology to an entirely new level.
Well, I'm pretty excited about it right now, and maybe after I get out of the golf pro shop tomorrow afternoon and I get my new bag and clubs, then we'll start talking about that, huh?
Am I going to be in trouble with your wife?
Oh, she won't know how to find you. I won't give her the address.
Okay.
'Cause, I like you too much to get you in trouble. So
Thanks.
anyhow. All right. Well, thanks so much. I appreciate it.
Based on the very positive and inquisitive feedback that I've received from my conversation with Dr. Robert Kornfeld, which was Season 2, Episode 4, which we discussed the integration of functional medicine into your podiatric medical practice, I wanted to share with you my personal experience and why you should really think about taking Dr. Kornfeld's excellent functional medicine course. Over 20 years ago, I quickly learned that we had to treat the whole patient, not just the symptom down in their lower extremity. But I did not have the luxury of being able to obtain something like Dr. Kornfeld's training course. I had to piece it all together. And truthfully, I am still piecing it together, as it is a constant and evolutionary process that will never end because new information is always becoming more and more available. But by taking his well-constructed course, you will have a strong foundation to continue that building upon. And oh yeah, maybe the best thing is that this will allow you to have the platform to launch out of the imprisonment of third-party insurance, which will improve your life. Think stress reduction here now, folks. And at the same time, you'll be able to optimize the lives of your patients. If you want to go from dysfunction to full function, start here right now. Functional medicine provides you with the powerful niche that will allow you to go into the direct pay model and be done with the insanity of participating with insurance. Go to his website now and tell him we sent you, because you don't want to be dysfunctional anymore. To get on board with this fantastic educational opportunity, go to Dr. Kornfeld's website, instituteforfunctionalpodiatricmedicine.com. That's instituteforfunctionalpodiatricmedicine.com.
We hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes, found at our website, podofinquiry.com. If this incredible and educational conversation has tickled just a little bit of your cortex, please leave us a review and spread the message to your friends and colleagues. Let's keep spelunking.
This podcast is designed for informational purposes only. It does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.